morning class. I'm sure you all remember my teacher's assistant, Megan. Okay, it's time to move on to our next topic, Graves' disease.
Oh boy, that sounds like a killer topic.
So Graves' disease is the most common autoimmune disease there is, meaning the body is producing antibodies that attack its own tissues, leading to the deterioration of said tissue. The antibodies produced by the immune system in this case are called thyroid-stimulating immunoglobulins, otherwise known as TSIs. These TSIs bind to thyroid cell receptors and trick the thyroid into producing excessive amounts of thyroid hormone, T3 and T4. This process is otherwise known as hyperthyroidism.
Wow, this is good stuff.
Yes, Cait. This disease is most commonly found in women, smokers, and people with a family history of hyperthyroidism. Although any age group can be affected by Graves' disease, it usually develops in people under the age of 40. Symptoms may include weight loss whilst having an increased appetite, heat intolerance, irritability, insomnia, sweatiness, diarrhea, and muscle weakness.
These symptoms sound too familiar. They remind me of my dear roommate, Jessica.
Cait? 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 Woo! Pretty hot. Wow. Oh my God, my legs hurt. Woo! Good night, everyone. Who's ready for breakfast?
No, that can't be it.
So if Graves' disease goes untreated, physical signs and symptoms will increase as well. A goiter, for instance, is an enlarged thyroid gland that can develop if symptoms worsen. As the goiter develops, a person's neck may become swollen and it may make swallowing difficult. It could increase coughing and even disrupt sleep and maybe even breathing.
Oh, my neck's a little swollen.
Nope, that's not it.
So eye problems are also associated with Graves' disease. Less severe symptoms include red eye, tearing, light sensitivity. A more severe symptom is protrusion of the eye. This occurs because of an inflammatory response in the eye that causes the smooth muscle and tissues within the eye to swell. When swelling occurs, the eyes have no place to go but outward, resulting in limited motion of the eyes.
Cait, do my eyes look big lately? They've been really bugging me.
How many similarities to my roommate? How funny is that? Right?
Another physical sign of Graves' disease is skin thickening. Some people will develop this over the front of their tibia bone, which can also include patchy and pink skin lesions. This disease is called pretibial myxedema.
You know, I'm starting to think my roommate should get checked out. I feel like she has one or two of these symptoms.
Now we know the symptoms to look for, but before we analyze the anatomical and physiological aspects of Graves' disease, we need to understand how thyroid hormones are normally produced.
Here is a picture of the thyroid gland. The thyroid gland is located above the trachea and just below the larynx. As you can see, there are two tubes located on either side of the trachea. The tubes are connected by a mass of thyroid tissues called isthmus. In a healthy patient, the thyroid works ideally to maintain a basal metabolic rate, or BMR. The BMR can be described as the amount of energy needed at rest to maintain basic vital functions in the body. The thyroid gland works to secrete hormones, tetraiodothyronine, or T4, and triiodothyronine, or T3. The purpose of these hormones is to assist in proper growth and development. They are also primarily responsible for determining the BMR.
This is a thyroid follicle and a picture of how the process works in a properly functioning thyroid gland. It begins with the thyroid follicles accumulating iodide from the blood and secreting it into the colloid. The colloid is a fluid within the thyroid follicle. Once the iodide enters the colloid, it is oxidized and forms iodine. The iodine then attaches to a specific amino acid called tyrosine, which is found within a chain of proteins called the thyroglobulin. If one iodine element binds to tyrosine, it will form a monoiodotyrosine, MIT. If two iodine elements bind to tyrosine, it will form diiodotyrosine, DIT. The thyroid-stimulating hormone, TSH, triggers the cells in the follicle to take up a small volume of the colloid fluid by ingesting liquid into the cell. This is called endocytosis. The hydrolyzation of T3 and T4 from binding to thyroglobulin will secrete the hormones into the blood. These hormones will then transport through the blood, assisting various body regulators, which will result in the decrease of BMR. This process starts in the hypothalamus with the release of thyrotropin-releasing hormone, TRH, into the blood. The anterior pituitary detects TRH and, as a result, releases TSH. The TSH then binds to the receptors on the thyroid gland. Once the hormones reach a normal metabolic level, the thyroid gland sends a negative feedback loop, which is the body's inhibitory response to protect from overproduction. The negative feedback loop is then sent to the hypothalamus where production of TRH is stopped. This leads to the inhibition of TSH in the anterior pituitary as well. Graves' disease also includes a negative feedback loop but differs by including antibodies called thyroid-stimulating immunoglobulins, TSI, that mimic TSH. The TSIs then bind to the TSH receptors on the thyroid gland and in turn activate secretion of hormones T3 and T4. The negative feedback loop works to inhibit the production of TRH and TSH. TSH is a key diagnostic measure when determining hyperthyroidism. This is because in a normal functioning thyroid, the inhibition of TSH should result in the stopping of the production of T3 and T4 hormones. Those with Graves' disease will continue to produce these hormones because the TSIs continue to produce them when the TSH has been inhibited.
And this process leads to the symptoms that we talked about earlier in class. All right, class is over for today, but make sure you study for our quiz next week.
Jessica, we have to get you to a doctor. This stuff is serious.
So, Miss Mooney, what brings you in today? Are you here for your annual checkup?
I feel fine, but my roommate made me come in. I mean, I've been really hungry lately, but I lost a bunch of weight, so I'm not too worried about it. Also, I've been so hot lately, but I think everyone feels this way.
Are you joking?
Muscles have been pretty weak lately, but I'm sure that's just because I haven't been sleeping.
Sounds like I want to look into that a little bit more. Do you mind having a seat on the treatment table for me?
Sure.
All right, now can you just hold your hands out in front of me, so don't let me push them down. Whoa, okay, hold them straight out, don't let me push them down. Okay, looks like you do have a little bit of muscle weakness.
Yes, this has been an extremely stressful semester for me. I've been so stressed that I don't even have time to go to the gym. I eat things that are conveniently found in my room, like bread and ice cream. I've also taken up soaking because I've been so stressed.
Okay, so I'm looking over your charts here, and I see that you've lost a significant amount of weight since your last visit. Based on the signs and symptoms that you present, I think I have an idea what your diagnosis is. Would you mind if I ran some tests to rule out other possible conditions?
No, I don't mind.
Well, I'm going to go ahead and start with the physical examination. You seem to be a little swollen here, and a little tender.
Yeah, it's very sore right there.
Yeah. Do you mind if I take your pulse?
Sure. It's a nice watch.
Thanks, I appreciate it. It's pretty new. All right, I see that you have an increased heart rate. I would like to run some blood measurements on your levels of TSH, T3, and T4 to get a better idea of what you got going on here. All right, so the test came back, and I'm afraid I have some disappointing news for you. You have Graves' disease.
Who is that girl?
I don't even know all that bad because there are many effective ways to treat your condition. Eating a well-balanced diet should be the most important of all treatment options. This will allow you to reduce your inflammation and enhance your immune system function. Foods that can help control your disorder are fresh nuts, veggies, anti-inflammatory herbs, spicy, and healthy fats. A well-balanced diet should be paired with some sort of daily exercise. This will make you feel happier, healthier, less anxious, and help you sleep. I also strongly advise that you quit smoking. Cigarettes are known to trigger autoimmune diseases, including Graves' disease, because they damage your healthy cells and tissues.
Oh, okay. I think I can do all of those things to help treat my disorder.
Great, because if you do not take care of this early, it will have to result in a more serious treatment option.
What do you mean by more serious treatment options?
The other treatment options range in severity. They include anti-thyroid medications, radioactive iodine treatments, and the most extreme option, surgery.
Please explain these options more in depth.
Yes, I would be glad to. So anti-thyroid medications prevent the thyroid from producing T3 and T4 hormones that are excessively produced in people diagnosed with Graves' disease. This is an effective treatment in relieving your symptoms and results within a few weeks, although hyperthyroidism will return if the patient stops taking these medications. Radioactive iodine works by destroying your thyroid tissues in hopes of finding a healthy balance of hormones from the thyroid tissues that remain. A side effect is that patients could develop hypothyroidism from this treatment. Hypothyroidism is where the body isn't producing enough thyroid hormones, which can result in the opposite body reactions because you are not producing enough thyroid hormones. Your last option would be surgery. This is an option for patients who cannot tolerate the medication or radioactive iodine, or if these treatments are not successful. This is also a safer option for pregnant women. There are a few cases that require surgery due to the extreme size of the goiter, which makes it the removal of the goiter necessary. The surgery removes part of or the entire thyroid through a small incision in the neck. The removal of the thyroid effectively treats patients with hyperthyroidism, but can result in hypothyroidism as well. If your symptoms were to continue to develop, come back and see us so we can reevaluate and see what treatment options would be best for you.
Thank you so much. Is there anything else I should know? Is my family at risk because I have it?
Yes, it is important to notify your family because although we cannot predict who will develop this disease, a person's chances increases if a family member has it. Graves' disease is most common in people under the age of 40. Women have a much higher chance of developing Graves' disease, actually 8 times more likely, and they are most vulnerable from the ages of 30 to 60. If someone is suffering with an autoimmune disease, their chances of developing Graves' disease will increase as well. Graves' disease is also more prevalent in African American, Asian people when compared to Caucasian people. Differences may result from variations in environmental exposure as well as genetic predisposition.
Thank you, doctor. I'll be sure to take care of myself so my condition does not worsen, as well as notify my family so they are aware that their chances have increased as well. Thanks for making me get checked out, Cait. You're a lifesaver.